Good morning, my name is Paola Ochoa, and I'm going to talk about Lenvatinib versus placebo in radioiodine-refractory thyroid cancer. Definition. Lenvatinib, an oral inhibitor of vascular endothelial growth factor receptors 1, 2, and 3, fibroblast growth factor receptors 1 through 4, platelet-derived growth factor receptor alpha, red, and KIT, showed clinical activity in a phase 2 study involving patients with differentiated thyroid cancer that was refractory to radioiodine, iodine 131.
Trial randomized patients with iodine refractory differentiated thyroid carcinoma to lenvatinib compared to placebo when the patients had progressive disease. And what the SELECT trial showed, presented last year at ASCO and recently published in the New England Journal of Medicine, was that there was a very significant progression-free survival benefit with lenvatinib compared to placebo of almost 15 months. So the magnitude was really quite large. And the response rates were really very high as well, 65%. So there have been a number of subset analyses that have been done looking at the various subgroups of patients and tumor types to see if we can call out who's most likely to respond to lenvatinib and who's not. For example, papillary, follicular, Hurtfeld cell thyroid carcinomas all respond to lenvatinib. We've also looked at prior therapy, whether patients have had one prior VEGFR TKI or not, and both groups of patients respond to lenvatinib as well. So what was presented here at ASCO this year is a subset analysis of how older patients did compared to younger patients. And basically what was found was that older patients responded as well to lenvatinib, just as younger patients did. And one thing that was perhaps somewhat unexpected was that there was actually an overall survival benefit seen in the older patients who received lenvatinib compared to those who received placebo. Now, the study design incorporated a crossover arm for patients who progressed when on placebo. They crossed over and received lenvatinib. So the concern has been that the crossover study design will mitigate an overall survival benefit that might be seen. So when we do actually see a survival benefit, even despite the crossover arm, I think it's particularly striking.
Applications in medicine. The median progression-free survival was 18.3 months in the lenvatinib group and 3.6 months in the placebo group. A progression-free survival benefit associated with lenvatinib was observed in all specified subgroups. The response rate was 64.8% in lenvatinib group, 4 complete responses and 165 partial responses, and 1.5% in the placebo group. The median overall survival was not reached in either group. Treatment-related adverse effects of any grade, which occur in more than 40% of patients in the lenvatinib group, were hypertension in 67.8% of the patients, diarrhea in 59.4%, fatigue or asthenia in 59%, decreased appetite in 50.2%, decreased weight in 46.4%, and nausea in 41%. Discontinuations of the study drug because of adverse effects occur in 37 patients who received lenvatinib, 14.2%, and 3 patients who received placebo, 2.3%. In the lenvatinib group, 6 of 20 deaths that occurred during the treatment period were considered to be drug-related.
Differentiated thyroid cancer historically has been treated by mostly surgery and radioactive iodine, and it was usually cured, and in most cases still is cured by those two modalities. However, there's about 10 to 15% of patients in whom even after surgery and radioactive iodine, the tumor may recur. And in those cases, if radioactive iodine is no longer taken up by the tumor or the tumor is dying anyway, other options were needed. Starting in about 2012, they had the first access to the kinase inhibitor sorafenib, and shortly after that, in 2014, the kinase inhibitor lenvatinib was approved. Both of these are multi-kinase inhibitors, and both of these provided patients with significant progression-free survival for the first time, giving patients for the first time a systemic option for treating patients, for treating their cancers. The phase 3 SELECT trial was a randomized placebo-controlled trial comparing lenvatinib to placebo in patients with differentiated thyroid cancer that was no longer responsive to radioactive iodine and also were not candidates for surgery or curative surgery. This trial was the watershed trial for getting approval of lenvatinib both in the United States and in the European Union, as well as other places globally. The patient selection was any patient who was radioactive iodine refractory, but they also have to have progressing disease within the prior 13 months or so. When we looked at the comparator between placebo for the patients who got lenvatinib, it ranged 2 to 1. The patients who received lenvatinib were significantly more likely to have a longer progression-free survival than the patients on the placebo arm. The placebo arm patient had approximately progression-free survival of about 3.8 months, whereas the patients who were on lenvatinib had a progression-free survival of 18 months. And so this is quite significant as far as patient care goes, and was the basis for the approval of for that time. In addition, we also saw a very, very significant overall response rate of 63% and an overall survival that was not actually reached in the original trial. However, subsequent data that we found looking at analysis later on is that in the subgroup of patients who were over 65, patients who are over 65 who had received lenvatinib were statistically significantly living longer than patients who had been assigned to the placebo group. So this is one of the first times that overall survival was seen to be extended in patients with differentiated thyroid cancer on any kind of inhibitor therapy.
Pros and cons. Pros. A progression-free survival benefit associated with lenvatinib was maintained in all pre-specified subgroups. A progression-free survival benefit was observed in patients with thyroid cancer of all histological types examined. Lenvatinib was associated with significant improvement in the response rate. Cons. 202 patients had disease progression, and 18 patients had died before disease progression. Progression of existing bone disease occurred in 9 of 38 patients in the lenvatinib group, 23.7%, and in 23 of 39 patients in the placebo group, 59%.
Here at ESMO 2015, I'm Thomas Waldrop for Oncology TV. This is Dr. Matthew Taylor from the Oregon Health and Science University. Thanks for stopping by, sir. Thanks for having me. So let's talk about this work you're doing with Dr. Kate Newbold with lenvatinib on its efficacy and safety. What can you tell us about this study? Sure. So this is a planned subgroup analysis based on the SELECT clinical trial. This was a large phase 3 clinical trial with a drug called lenvatinib, which is an oral multi-kinase inhibitor. And this was specifically for patients with metastatic differentiated thyroid cancer. And how did you go about doing this? What were the methods? So this was an international clinical trial that was done across many different sites. And so patients were eligible to participate in the trial if they had metastatic radioactive iodine refractory thyroid cancer. Patients were randomized either to get placebo or the actual study drug lenvatinib, 2-to-1 randomization lenvatinib versus placebo. And so the clinical trial basically demonstrated some very impressive clinical efficacy with the drug, showing a large percentage of patients having a very good response to the medication and improvement in progression-free survival. What stands out most to you in the data? I guess what stands out is how quickly the patients responded, how quickly the tumors decreased in size, and the magnitude of
So a substantial number of the patients responding very well, and the duration of the response was impressive as well, around 18 months.
So how do you build upon this? Where do you go next?
I think the field is moving in the direction of combination therapies with targeted therapeutics plus immunotherapeutics. So I think that's really what we're going to see. This abstract in particular we presented with Dr. Newbold was focusing on the different groups of patients that had previously been treated with an anti-VEGF drug and those who had not been treated. And so what this abstract in particular focused on was the fact that whether patients were previously treated with an anti-VEGF therapy or not, just came right into the clinical trial, were treated with lenvatinib, the response rate and the progression-free survival were similar in both groups.
Thank you, Dr. Taylor. We appreciate it.
Thanks for the time.
Nicely done, sir.
Thank you.
Issue applied in Ecuador. At the global level, Ecuador is one of the countries with the highest incidence rate of thyroid cancer. However, mortality data are scarce and not rigorous. It is important to raise awareness of updated and reliable population-based data on the trend of thyroid cancer mortality in Ecuador. Conclusion: Lenvatinib, as compared with placebo, was associated with significant improvement in progression-free survival, and the response rate among patients with iodine-131 refractory thyroid cancer. Patients who received lenvatinib had more adverse effects.